I'm Dr. Geary, Premier Family Care.
Should a person worried that they might have Alzheimer's visit their primary care doctor first?
I think it's always a good idea to talk with your primary care doctor about your concerns. Many people experience changes in their ability to recall names and places and where we put the car keys, and more often than not, those are normal changes that all of us are going to notice to some degree at some point. But if you're having significant difficulty with recall or inability to remember how to do things that are common to you or places that you would normally go, then it's absolutely worth talking to your doctor about the kind of things that you're experiencing and maybe some new behaviors that you or a family member or loved one have noticed, because there are certainly some tests that we can do to look for underlying causes or to figure out the extent of the change in the memory or the thinking and see if it could be consistent with something like Alzheimer's as opposed to just normal changes of life.
What are the benefits of an early Alzheimer's diagnosis?
So it's essential that we be diligent watching for changes in memory and activity in our loved ones if we have suspicion about dementia or if there's a family history of Alzheimer's. Early diagnosis is essential to be able to determine the correct treatment for a person in need. I always tell people that there are different phases of dementia for those that it does afflict. The first phase is the time in which people are starting to have memory and functional changes, but we're just not really quite sure yet that something abnormal is going on. And unfortunately, that period can oftentimes be elongated as we either don't see the signs or maybe we're in some denial. But unfortunately, that delays an appropriate diagnosis, after which families and caregivers and your doctor can help come up with a plan to treat with appropriate medications and make necessary changes in the home to keep a person safe and healthy.
What are the medical options for someone diagnosed with Alzheimer's?
So there are a few medical options nowadays for people experiencing dementia and Alzheimer's specifically. Medications tend to focus on slowing down the process in a brain that makes it difficult for people to do their daily activities. And while we don't always see explicit improvements in the ability to calculate and remember and do certain things, oftentimes you'll see an improvement in the ability to go about day-to-day activities of daily living, which goes a long way to keeping a person safe and happy in their own home as much as possible.